Good morning, everyone. So, again, we have come with the topic of community ophthalmology. Last time we have discussed what is community ophthalmology, what are the principles of the community ophthalmology, okay, and we have also discussed about the blindness, what are the different type of blindness are there, how many types of blindness are there, which are very important for your short notes and also in your multiple choice questions. So we have discussed like what are the different type of blindness, that what are the economic blindness, what is legal blindness, what is social blindness, what is manifest blindness, what is absolute, curable, preventable, and avoidable and incurable blindness. So we have discussed the 9 type of blindness in the last class. Okay, so you have to be thorough about this, and you have to learn the definitions about the each blindness. Okay, and last time we have also discussed what are the and to prevent these blindness, we have also discussed what are the different programs which are included in the community of ophthalmology to control these to control the blindness. Like we have discussed about the NPCB, that is a national program for the control of blindness. We have discussed about the Danida program. Okay, so what are the and we have also discussed what are how to prevent the diseases which are included under the, and also we have also discussed about the Vision 2020, which is very important, and it also come in your like it's also come in your theory paper, like it comes in like in the form of long questions. Okay, so we have also discussed, we have, you have to be thorough about the Vision 2020. And we have discussed in detail about the what is Vision 2020, what are the different diseases which are included in the Vision 2020. So these, what are the diseases in the which are included in the Vision 2020? So these are the like cataract, childhood blindness, refractive error, glaucoma, corneal blindness, diabetic retinopathy, and the trachoma. Okay, so these are the 7 diseases which comes under the Vision 2020 program, and and we have to overcome these diseases to prevent blindness. Okay, and we have discussed various healthcare centers, and we which are included under the community of ophthalmology. So now we are continuing that. Now we are continuing with the small brief, like general brief about the what is community of ophthalmology. So what is the community of ophthalmology? As we have discussed, so community of ophthalmology was described as a new discipline in medicine promoting eye health and blindness prevention through programs like utilizing methodologies of public health, community medicines, and ophthalmology and it is in 1970. This new discipline was first proposed by the Dr. Patricia E. Okay, so this is a like Dr. Patricia had proposed a new discipline, that is a new discipline about the what is a community of ophthalmology. So in brief, what is a community of ophthalmology was described as a new discipline in medicine promoting eye health and blindness and prevention through programs that we have discussed, like national NPCB program, Danida program, utilizing methodology of public health and community medicine and ophthalmology. Okay, so these what is community ophthalmology. Second, and we have also discussed what are the different components of the primary eye care. So components of the primary eye care are: first, eye health education; second, symptoms identification. We have to give what are the eye health education, symptom identification. Third is a visual acuity measurement. Fourth is the basic eye examination, diagnosis, and timely reference. So these are the primary components of the primary eye care. That first we have to counsel about the what are the eye health. We have to educate the people about the eye health, like what the proper nutrition. It includes like the proper nutrition, proper exercise of the eye, okay, and use of glasses, appropriate glasses. So these comes under the eye health education. Second, symptom identifications. We have to identify the symptoms as the patient which come to us will come with the symptoms. So we have to identify these symptoms and we have to treat that symptoms. This comes under the primary eye care. Third is a visual acuity measurement. It should be meticulously measured. Visual acuity should be meticulously and properly be measured. Okay. that visual acuity should be measured only by uniocular, not the binocular. Okay, so proper each eye visual acuity should be measured properly. Fourth is a basic eye examination. So basic eye examination, which includes the uh, anterior segment examinations. That is the eye examination. Includes, it comes under like the slit lamp examinations. We have to eye thoroughly examine the eye, anterior segment of the eye under the slit lamp. So it comes under the basic eye examination, and we have to make proper diagnosis. So, and it should be timely refer. If in the patient needs referral, if it needs to refer in the higher center, or so it should be timely referred. Okay. So these are the components of the primary eye care. Okay. And last time we have also discussed in the community of ophthalmology, the 3 E's are important. Okay, you remember or not? Okay, so in the community of ophthalmology, the 3 E's are important. What are that E's? First is the excellence, efficiency, and the equity. Okay, efficiency, excellence, efficiency, and equity. Thus, have high ethical relevance in the practice of the community-based ophthalmology. Okay, essentially, it translates to the delivery of the highest possible quality of eye care to the spectrum of the society with optimal distributive justice and the efficiency. Okay, so these 3 E's is important. It's the excellence, efficiency, and the equity. Okay, it should be followed in the community of ophthalmology. So it factors the translation of the delivery of the highest possible quality eye care to the maximum maximum populations. So it should cover maximum population with the highest possible quality of eye care, and it should be distributed equally in each and every person. Okay. In this equity, however, is expressed elegantly by the Rick Riordan in his book, that is a red pyramid. It does not mean that everyone gets the same. It means equity does not mean that everyone gets the same. It means everyone gets what they need. It's not like that some person came and he needs glasses, but you will give him, will do his surgery. Okay, so this does not mean equity. Equity means, it does not mean that everyone gets the same. It means that everyone gets what they need. If the patient needs glasses, then we have to prescribe the glasses. If he needs the conservative management, like by the medicine, you can give medicine. If the patient definitely needs surgery, then you will go with the surgery. Okay. So what they needed, that means everyone gets what they needed. It means equity in this, it means that. Okay. Several interventions that are considered effective may not be exactly cost effective. Okay. So what does this line means? That several interventions that are considered effective but may not be exactly cost effective. So this means that in some patients you need, suppose in a case of a retinal detachment. Okay. In retinal detachment case, you need, that is indicated that you need a surgery. Okay, it is effective, but it is not cost effective for every patient. So in this case, if the patient, according to the type of retinal detachment, if it's a small retinal detachment, if it's a horseshoe shaped retinal detachment, or it is a full, like a completed total retinal detachment. So in these 3 types of retinal detachment, the interventions are very different. So if a patient comes in your OPD and you say it has only the very small retinal detachment, and you say that you have to go for the you have to go for the retinal detachment surgery. So it could not be possible that patient can't, it is not be cost effective for that patient, and maybe that patient may be not affordable. So according to the patient come, what are the patient's status? In that way, to consider that, we have to prescribe the surgeries. Cost per disability adjustment life year may be more valid criteria to decide on effective interventions for a community. Okay, so according to that patient's status, we have to prescribe or we have to counsel about the interventions about the disease. Okay, so this comes under the efficiency. Suppose, like for example, performing hundreds of cataract surgeries in a camp in a very short period with a minimal utilizations of the resources, but with a high rate of complications or poor visual outcomes does not meet the norm of excellence. Okay, so like you have performed you have performed hundreds and hundreds of cataract surgery in a camp in a very short period, and the outcome of that surgery is very bad. Okay, so and the outcome of the surgery came like the patient complains of end up into the endophthalmitis or end up in a visual loss. Okay, and end up into the blindness. So it does not meet the norm of excellence. Okay? Thus, a perspective understanding of and a balance between excellence, efficiency, and equity are very critical in the planning and delivering of community-based eye care services. Okay, so that's why these three E's are important. Okay, that is excellence, efficiency, and equity. Okay. Oh. Now this is the summer. The committee, that is the Committee on the Quality of Health Care in America, in its report, that is the Crossing the Quality Chasm, recommended 6 attributes for an ideal healthcare system in the 21st century. So these recommends, the Committee of Quality of Healthcare recommends the 6 attributes of the ideal healthcare system in the 21st century. Okay, first is safe, avoiding injuries to the patient from the care that is intended to help them. Okay, so we have to avoid the injuries to patient from the care that is intended to help them. So we have to do like we have to give, like we have to do surgery, that we have to intervene that patient with the resources that is helpful for them, but not, but they did not provide any they did not give any injury to that patient. Okay, so it should be safe. Any intervention should be, that is any intervention that is needed for that patient should be in the safe. Okay, effective, providing services based on scientific knowledge to all who could not benefit. Okay, the second is the safe. So avoiding injuries to patients from the care that is intended to help them. Second is the effective, providing services based on scientific knowledge to all who could benefit and refraining from providing services to those who are not likely to benefit. Okay, so it should like effective. Whatever the treatment you are giving, whatever the services you are providing to them should be effective. That is avoiding underuse or overuse. Yeah, that is provide services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to benefit. Okay, unnecessarily you can't give any unnecessarily you can't give any treatment, other prescribed drops, or by use of any unethical drops, whatever that the quack doctors do. So you should avoid this. So avoiding underuse and overuse of resources or treatment. Okay, so effective means providing services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to be benefited. Okay, third should be patient-centered. It is important, that is providing care that is respectful of and responsive to individual patients' preferences. needs, and values, and ensuring that patient value guide all clinical decisions. Okay, so this was this that we have discussed, that is providing care that is helpful and respectful to and responsive to individual patient preference. Okay, so that means that if we have to see the patient status, patient's economic status, according to that you have to prescribe, or you have to give, or you have to guide the patients about any treatment. So it should be patient centered. Okay. Fourth is time. That is reducing waits and sometimes harmful delays for both those who receive and those who give care. So timely, it is important. So we have to timely refer the patients if it needs treatment or the surgery which are not provided in your institution and it needs the higher center referral. So it should be timely referred. So it reduce waits and sometimes harmful delays. Okay. Fifth is the efficient avoiding waste, including the waste of equipments, supplies, ideas, and energy. So we have to effectively or efficiently avoiding the waste of equipments, supplies, ideas, and energy. So these are very important. We do not have to waste the equipments, do not have to waste the supplies or ideas and the energy. Six is the equitable. That is providing care that does not vary in quality because of the personal characteristics such as the gender, ethnicity, geographic locations, and the socio-economic status. So, okay, there's an equity that comes under your ease also. That is equity does not mean that we to give the every treatment we have to give to all. It also, that is who is needed, will give that treatment. And equitable in this and conditions means it should not be any that is provide, it should not any conspiracy between the, no, he is like he is from different caste, he is from the different gender, he comes from the different geographic locations. No, each patient should be considered equal. That is equitable, that is providing care that does not vary in quality because of the personal characteristics such as the gender, ethnicity, geographic locations, and socioeconomic status. These attributes should form the backbone of all the community-based eye care interventions. Okay. So these important. What are the 6 attributes which recommends the committee of, and it is important and it should be followed in case it should be followed if you are going in under the community of ophthalmology. So if you are going, if you are community of ophthalmology, if you are running your own OPD, and it should follow by everyone. Okay, so 6 attributes are the same: effective, patient-centered, timely. It should like the time should is very important. Efficient, avoiding waste, and equitable. So these 6 are very important. Attributes are important in an ideal healthcare system. Okay, so we have dealt with the complete community of ophthalmology chapter. Okay, so you have to read what is community of ophthalmology, you have to read the definition, and you have to properly write the what is the community of ophthalmology definitions, what are the principles which are included under the community of ophthalmology, and you have to also read about the what are the different type of blindness. So there are 7 or 8 types of blindness are there, and you have to read and you have to learn the definition of that blindness. It comes in the questions, long questions or short questions, and you have also learn about the what are the different programs in the national programs which control the blindness, like national program of control of blindness, NPCB, Danida. These programs you have to read, and what are the diseases which are included under the Vision 2020 program, and how do you care, and how do you how will you diagnose these cases, and how you will take that what are the treatment which are required to control them, these diseases. Okay, so you have to read every disease is very importantly and individually, and with the treatment also. Okay, and Okay, and also you have to write the what are the different diseases which come under the Vision 2020 program, and Vision 2020 itself is very important topic. Okay, so lastly, these slides are the brief of that your community ophthalmology chapter. Okay, is there any questions you can ask? Okay, any doubts, any questions? Okay, thank you.